It is currently 8:12, hot and humid today. Chance for afternoon showers or a shower as always. I can't limit it to the afternoon. Of course, there's some tropical weather, tropical disturbance down near the Antilles that could move, and the Gulf threaten it. The models have it stalled over Florida, but we are at August 1st, and that means it's the peak of hurricane season, and we're heading toward the active time. So if you haven't started preparing, now is the time to do so. And Dr. Brent Wallis, our friend, Chief Medical Officer of People's Health, joins us now to talk about hurricane kits and to share some tips for protecting your health during a weather emergency. How you doing, Dr. B?
Hey, Tommy, I'm good. How about you?
I'm all right. If it wasn't this, it'd be something else, right?
I know, always.
Let's talk about a hurricane kit. What is that?
Yeah, like you said, we don't really want to talk about this, but it's important to. A hurricane kit is really just a collection of all the items that you might need during a weather emergency. And you want to make sure that it's really well stocked to either help you if you're going to evacuate quickly or if you're going to stay and shelter in place during a hurricane. And it's really easy to create one. You just really gather all your supplies that you need, put them in a carry container, something like a duffel or Tupperware, and store it somewhere and keep it safe, accessible, so that you and your family know exactly where it is.
You know, as simple as it seems, the first step really is getting a duffel bag or a container so that you can, A, assemble everything in one place, and B, have it easy to grab if you do have to do that. What are some of the must-have items to put in that duffel bag or in that kit, Doc?
Yes, I mean, it's going to be different for everybody. So everybody's kit's going to look a little bit different. But in general, there's a few things you want to make sure you've always got available in that, one place that you can go to. And really critical is going to be a first aid kit. You can get that really almost anywhere. It's going to have things like triple antibiotic and Band-Aids, bandages, things like that you might need because there could be an accident or something and you won't be able to access direct urgent or emergent care. You want to make sure you've got personal hygiene items, so things like toothbrush and toothpaste and deodorant, because you may be evacuated with a bunch of people. You want to make sure you have all of that stuff. Some extra clothes, definitely, because you may get wet. A sleeping bag or maybe a blanket if perhaps you can't find a place to go if you do decide to evacuate. If you're staying in place, you want to make sure you have flashlights and extra batteries, which is really key. Sometimes people forget to pack the batteries. And then what's really critical is a portable phone charger. You can get these anywhere. And your phone may be your only access for information. So it's really important to make sure you can keep your phone charged. And then make sure you include copies of important paperwork, things like your ID, your health is going to be critical. And then you may want to include copies of any of your insurance documents if something does happen and you need to start calling around to try to figure out how to get repairs.
And sometimes, I guess, the essentials, food and water, can be overlooked, but you can't do that.
Yeah, I mean, you've definitely got to have food and water. And so the American Red Cross really recommends that you should have at least 3 days of food and water each person in your house. So that's a lot. It's necessarily all going to your duffel, but at least have it nearby. That includes 1 gallon of water per person per day. And then any additional food and water, you want to make sure is kind of, around your duffel area so that you've got those in case you decide you're going to stay and shelter in place. Because as you know, a lot of times the convenience and grocery stores are not open right away, or perhaps they don't have power. So some of those things you're not going to be able to get immediately after a storm.
What are some good kind of foods to have in that hurricane kit?
Yeah, it's a good question. You want to make sure you've got stuff that is non-perishable, so shelf-stable foods, things that don't need to be refrigerated or even cooked. And there's a lot of options. You can do a lot of canned fruits or vegetables, soups even. For protein, make sure you've got a couple of packages of energy bars or breakfast bars. Those are really good. Nuts are excellent because they're a great source of protein, and even nut butters, things like peanut butter, as long as you don't have an allergy. If you eat meat, dried meats are good, things like jerky. can provide a little bit of protein to you. Keep in mind they've got a lot of salt though, so watch out for that. And then canned seafood, things like tuna and sardines are going to be a good source of protein, and they don't go bad for a really long time.
Doc, you seem to be ignoring the potato chips and M&M category.
You definitely are going to have some of those. Just don't overdo it.
Yes, exactly. What about some health-related items? What kind of thing like that should you have in a hurricane kit?
So absolutely, if you are on medications, make sure that you bring those along with you. And if possible, you bring the original container with you as well. And the reason for that is because pills are, small, and they are different sizes and shapes and colors. And so your actual bottle will help if something happens to your medicine and you need to get additional pills or a refill. So the other thing I tell people to do is actually have your doctor print out a list of all your medications and just throw that list in your emergency duffel as well. And then any other supplies, don't forget things like dentures. If you wear dentures, make sure you've got them in your bag as well. Eyeglasses, you want to be able to see and hear as well. So hearing aids, if you've got those. And then if you've got mobility problems, make sure that you know where either your walker, or if you've got a wheelchair, you've got to make sure you take that with well. Just make sure that all those items that can help keep you safe and that are hard to replace are available and ready to go when you need them.
And you really don't want to, if you sort your pills, that's fine, but you want to bring the original containers and all of the medication because you don't know how long you're going to be gone, right?
Yeah, exactly. And it's those pill boxes are wonderful, but once all the pills are in there, sometimes you don't know which one is for what. And if you show someone else, they may not have any clue what they are. So the bottles will really help to know what you're taking.
And sometimes when it comes to refills, the refill generic might not look the same as the other refill generic that you got before that. A lot of those items can't stay packed away, though. How do you remember to grab them in an emergency?
Yeah, so absolutely, you can't fit everything in there. And so one thing you can do is make a list of all the items that don't fit, but you need, and just keep that list with the duffel. That way, when it is time to go, or if you've got access to all of the stuff that you need, you pull that list out and you know exactly where it is so that you don't forget anything or spend a lot of time searching for it.
How often should you update that hurricane kit?
Yeah, I mean, you definitely should update it frequently, at least once a year, because what you want to do is check for any expired items and throw those out and replace them, especially the food and the medications. You want to make sure that they've all got dates on them. Batteries, which are really critical for those flashlights. And if you've got a battery charger for your phone, make sure the batteries still work because they do go bad over time. And then really update your hurricane kit if your needs change. So maybe you added somebody to your family, and so you need to have more food and water for an additional person. Maybe your medication routine changed, or you were diagnosed with a new health condition. So you want to make sure you update that with the additional medicines and a new med list. So just anytime you have a change, you want to make sure you update your kit as well.
All right, Doc, let's take a break. We'll pick it up. We come back talking about people with chronic health conditions. And when we do come back, Dr. Brent Wallis, Chief Medical Officer of People's Health, is with us talking about, and this was scheduled before that tropical disturbance in the Gulf, but we knew August was coming, and that means increased tropical activity. We're talking about hurricane preparation. We'll continue the conversation when we come back. 821 Traffic Now, WWL. 825, Tommy Tucker, WWL, Thursday morning, talking to our friend, Dr. Brent Wallis, Chief Medical Officer of People's Health, about hurricane preparation August 1st, and that means we're heading into the peak of hurricane season, and we're talking about having a hurricane kit and some of the things that you need to have in it and how often you should update it. You can download the Odyssey app, go back and listen to this with the rewind feature, or click on my name and recap all of this conversation with Dr. B so you can make sure your hurricane kit is good and ready to go. Doc, when it comes to people with chronic health conditions, any special hurricane preparation advice for them?
Yeah, absolutely. If you've got a chronic or a long-lasting health condition, you probably need to do some additional planning and kind of think about the steps you need to take to make sure there's no interruption in your treatment. And, an example would be somebody with kidney disease that's on dialysis. You may not be able to receive dialysis locally after a storm, so probably you're going to need to evacuate. But if you evacuate, you need to know where to go. So you want to ask your doctor, for recommendations on where you can continue your treatment, and even ask them for a printout of what the doctors are and throw those in your kit as well, especially if it happens suddenly and you need to get out of town. You can also talk to your health insurance plan about any rules they may have about getting care if you're outside of your state or the local area where you normally receive care.
How about preparation for people with diabetes? And in this area, a lot of people have diabetes.
Yeah, absolutely. There's a huge number, probably 30% of people here have diabetes. And so you want to actually make sure that you've got a plan to check your blood sugars frequently. Stress, evacuation or a storm, that stress hormone actually increases your blood sugar. So it's even more important to make sure that you're trying to eat right where you can and that you're taking all of your medicine. And diabetics know about this. Definitely have in their kit something called a glucagon emergency kit. It's when your blood sugar drops too low. They want to have a blood glucose meter with the testing strips and lancets to make sure they can check their sugar, and make sure you have about a 2-week supply of insulin, as well as all the insulin supplies if you are on that. And those foods that you pack in there, make sure you've got some that can raise your blood sugar, and throw in some sugar tablets or hard candies, because you don't want to have low blood sugar when you're in an emergency.
Couple of texts coming in. Somebody says put a can opener in that kit. That's a good idea. Somebody else is asking how to get the insurance company to cover the extra supply of prescription medicines. And we're going to cover now with Dr. B what you do if you need to fill a prescription during an emergency or to get prepared ahead of time. How do you go about that, doctor?
Yeah, so you want to make sure that you've got at least 2 weeks of medication. So if you're running lower than 2 weeks when an emergency is about to happen, you want to make sure you talk to your doctor and see if they can write for another prescription. And a lot of times, the pharmacy may even tell you, oh, it's too soon, we can't fill this. But keep in mind that during an emergency, health plans usually waive some of those coverage requirements and the timing of when you can fill your medication. So you can always give your health insurer a call, and they'll usually tell you, okay, it's okay to go ahead and get a 2-week supply or even another month or an early fill of your prescription, or that you can go to an out-of-network pharmacy if you've evacuated, but have the same copay you would in an in-network. So make sure you call your health insurer about that too.
And if you can't or you run out, sometimes after a storm, they'll give you an override or whatever to go out of network and all that?
Yeah, absolutely. And the pharmacists can help with that as well. I know if you evacuate and you end up in a place you've never been before, some of the national chain pharmacies can look up your prescriptions. But if you've got those bottles, they can usually figure out what you need, and they'll get it authorized for you.
Bring the bottles of medicine, not scotch. Final advice, Doc?
Exactly.
Well, you can bring the scotch too, just don't overdo it. Any final advice?
Yeah, I think the biggest thing to keep in mind is don't wait on this. We've already had one storm in the Gulf, and it's not looking great for the forecast this year. So don't wait until there's an actual warning issued. Grocery store shelves are going to be empty. I'm sure you've all seen it before. You don't want to wait until the last minute. And the other thing is sometimes it can be difficult to get in touch with your doctor. So make sure that you've talked to your doctor about your plan, and you know exactly what you're going to do. So try to do all of this as early as possible. This weekend is a great opportunity to do it, since we've got something coming, and try to stay calm and gather the supplies you need so that you're ready to go.
I'm of the belief if you put a kit together, you'll never use it, and then we don't get threatened by storms. So I'm going with that. Thank you, Doc.
That would be the best.
Appreciate
Thanks,
it.
Tom.
Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health. The only thing I'll add is that if you're older and you plan on staying, you need to remember how hot it's going to be after if you don't have a generator. Find out more about People's Health. You can visit the People's Health Medicare Center in Metairie. It's at 3017 Vets, right next to Party City. Appointments are recommended, but walk-ins are welcome. You can always go to peopleshealth.com or call them at 1-800-978-9765. It's peopleshealth.com. We'll talk about the Middle East when we come back. 8:31 time for WWL First News.